Hi, I'm Jake, and today I'm going to tell you about a medication called Phenelzine. I'm going to try to keep it as brief as possible. But here's the deal, you probably never heard of it. If you have treatment-resistant social anxiety, you really need to hear about it and consider it as an option. And frankly, I think everyone that has severe anxiety that's tried a bunch of treatments, nothing has worked, and they have treatment providers who have run out of ideas, you need to think about trying this medication. You need to ask your doctor about it. And if it sounds right for you and your doctor says we're not trying it, you need to think about getting another doctor. Let me tell you a bit about me first. I have severe social anxiety. I have avoidant personality disorder. I've spent the last decade basically dysfunctional, disabled, no employment, no social life, all the good stuff. I've had many therapists basically tell me they don't think they can help me, try somebody else. I have a great therapist now, but I need more than that as well. And I've had similar experiences in psychiatry, and my current psychiatrist even told me, you need to keep coming to me so that you can get your prescription for mirtazapine to help you sleep, but I don't really have anything else to try to help you with anxiety. We've hit a dead end. The truth is there was something else to try. It's called Phenelzine. So I want to tell you a bit about, first, what the medication is and why you probably never heard of it, and then we'll get into the pros and cons. So, it's an old Maui drug. A Maui is an inhibitor of the MAO enzymes in your brain. And I'm not going to talk too much about that because I'm not a science guy, but I've read a ton of research papers to try my best to understand. And I've provided a whole bunch of links below. Well, it's one document that links to a bunch of papers. So check it out if you want to read the science, and I do recommend it, but for the sake of brevity. It's an old Maui drug. It was developed a long time ago, and Mauis in general are these days branded as being outdated, risky, and not worth prescribing. And this is basically all that a lot of new medical students learn about Maui drugs. They don't really learn about why are they still legal to prescribe and why do people still prescribe them. I guess it's just for old patients who are used to it, right? That must be it. So many doctors are barely familiar with the drug in the first place. So patients are almost universally not familiar because doctors don't think about these meds much, and when they do, they just think about them being bad. So I'm going to tell you why I don't think necessarily that they're just bad. So I've tried a ton of different medications for anxiety. Nothing has helped me except this. This has finally started helping me. And I started taking it about a couple months ago. And I've been working on the dose and everything to figure out what's right for me. So first off, I want to tell you what it does for me. So it reduces physical and mental symptoms of anxiety. How awesome is that? I've taken propranolol before, and that helps with physical symptoms some, but it lasts about 3 hours. It does nothing for the mental symptoms, and it doesn't totally resolve physical symptoms like chest pain, stomach ache, headaches, sweating, chattering teeth. I have a bunch of physical symptoms that just go crazy. This medication is more effective at dealing with them. It lasts all day, and you can take it every day. And it helps with mental symptoms of anxiety. So I'm going to try to be quick about this here. But as someone who has avoidant personality disorder, some mental symptoms of anxiety I deal with include my brain completely freezing and becoming dysfunctional around other people, hyper-focusing on things that I think other people are expressing with their body language or their speech, or what I'm expressing with mine. My brain completely freezing, total inability to focus on or do anything, even things that I know how to do, even things that are very simple. And then I have a lot of problem with ruminating on shameful feelings afterwards and dreading things coming up. Phenelzine pretty much helps with all of that. And stuff like mindfulness that has never been helpful to me before is something that's actually possible for me now. It's like, usually when people would be like, well, it's not logical for you to be anxious about all this stuff because no one really cares. Like, yeah, I know that, but in the moment, it doesn't help me at all. Now it's something I'm able to be more aware of with the help of Phenelzine. And frankly, it's hard to explain exactly what the deal is. I still have anxiety. I still get stressed about stuff a lot, but my thoughts are so much more manageable and normal. And when I'm not in the anxious moment itself, I have far less circling, ruminating, shameful, dreadful things going on. And I can just focus. And if I'm like stressed about something in particular, it's during it, it's a little bit after it, and it's a little bit before it. And it's not literally my entire life. And it is still manageable while I'm actually doing things. And so I can exist in the world. Again, I'm not fixed, I'm not normal, but it is amazing. Nothing has ever helped me. I mean, the only thing that I've taken that ever felt like it changed my mental processes at all, I did ketamine infusions, but you know, you can't walk around and talk while you're doing ketamine infusions, and I didn't have any lasting effect from those. So, a couple more pros of the medication in addition to what it actually does. It's effective 24/7, so it does it all the time. It does not impair your ability to do things like driving, like benzos might. It's not addictive, like benzos are. And personally, benzos, on the occasion that I've taken them, have not seemed very helpful to me. I know they can be helpful to other people for anxiety, but I think this drug is actually worth trying before benzos. And so many, not all people, but many people report not developing any resistance to this medication over time. I've read anecdotes of people who've been taking this med for multiple decades for anxiety, and they take exactly the same dose they did as they figured out their starting dose within a couple months of starting to take it, which is really cool. So let's talk a bit about the cons. So why are people so scared of it in the first place? Why are doctors so worried about it? It does have side effects. I have had the most side effects and the most intense side effects of any medication I've taken. I'm going to get that out of the way. However, 2 points. One, I have managed them to the point where I am near what I would consider 100% management of side effects. I'm very happy with where I am. And it took some doing because there's just not a bunch of information about this medication and how it actually works. The next video I'm going to make about this medication, which will be up at the same time and linked in the description, is about how to manage taking the med. If you decided you're going to take it or you're already taking it, here's what you do, stuff about dosage, stuff about dealing with side effects, all of that. The point of this video is just to say, yes, there are side effects. You can manage them. The other video will be about how. And it is totally worth it if you've tried stuff for anxiety and nothing has done anything. This will probably do something. I would expect at least that it will become the closest to having done something because, like I talked about, there are some research papers linked below, and some of them just kind of state unequivocally that Phenelzine is kind of the best medication for treatment-resistant social anxiety. That doesn't mean it's the first one you should try. So let's talk a bit about that. Medication classes I would recommend you try first, just based off my understanding of what doctors like to prescribe and what are generally considered safer. Try SSRIs, try SNRIs, try TCAs, which are tricyclic or tetracyclic antidepressants. And also try individual therapy, which I totally also recommend doing at the same time as any medication, including Phenelzine. But you should try all those things. Maybe they'll help your anxiety. If you have severe anxiety, I don't think they probably will. But they're worth a try, and doctors are going to want you to try them first. And if they do work for you, regardless of how much anxiety you have, that's great. Because, yeah, they are generally more well tolerated. So you should try that first. Then there are things that I would say are alternatives to consider at around the same time. So group therapy is awesome. And I haven't actually done it yet, but I'm going to be starting it next week. But I strongly believe that it's awesome because it is exposure, right? But it's the safest form of exposure in that you're interacting with other anxious people. The thing about group therapy, and the reason I haven't actually tried it yet, is that it can be very hard to access. What is working for me is to have a great individual therapist and then just kind of ask her to start a therapy group. And that worked for me, and now we're about to start, and I'm really excited. So if you have access to one, I would recommend you try that. And again, that is something I recommend doing in addition to medication too, and I'm going to be doing it while taking Phenelzine. But medication speaking, if there's an alternative you want to consider at around the same time as Phenelzine, I would say anticonvulsants are worth a try. So anticonvulsants like pregabalin and gabapentin are considered anticonvulsants and prescribed off-label for anxiety. The thing is, they affect levels of a brain chemical called GABA. And I think if you have treatment-resistant social anxiety, you probably have a GABA deficiency. Phenelzine also helps with that. Personally, I've tried pregabalin, it did not help me, and they can be addictive and you can't necessarily take them all the time. They're a little bit like benzos, they're not as bad as benzos. Personally, I think Phenelzine is better. However, I can also say when I was taking pregabalin, I did not have any side effects. So that is worth thinking about. I would say after you've tried all of those things I mentioned, you should be thinking about Phenelzine next. So there's some examples of treatments I would not consider trying first that are things that your doctor might recommend or that you might read about. So ketamine infusions, I've done those. It was not a bad experience. It was expensive. It felt good while it was happening. It didn't have any lasting effect. I think that's because basically the main benefit is supposed to be neuroplasticity, so you can replace bad memories and feelings with good memories and feelings. But if you have super bad social anxiety, good luck actually implementing that in practice. Another thing I would not try first are benzos. For some reason, doctors are more willing to prescribe benzos than Phenelzine, and they do help some people with anxiety, and I do think they're worth trying eventually if something like Phenelzine doesn't help you. But I think you should try them after something like Phenelzine because they can be addictive. You can't take them all the time. They don't work the whole day when you do take them. You are often unable to drive while you're taking them. I think it's technically illegal. Some people do anyway, but they can be addictive, and often you develop a resistance and have to increase the dose, and eventually your doctor might stop prescribing them, which are stories that I've heard from people who did find help from benzos. So personally, I would recommend you try Phenelzine before benzos. Other things are, for example, transcranial magnetic stimulation. It can help anxiety. It can also cause other issues like memory issues. I haven't tried TMS. It sounds pretty intense to me. There's also like electroconvulsive therapy, which to my understanding is more for depression than for anxiety, but often we have both. And so it's something I've thought about as well. Similar issues, it sounds like it very often causes memory issues, and yeah, haven't tried it, and I don't really want to. So let's assume then that you've tried all of these things that I suggested you try first, or you've talked to your doctor and they're out of ideas and you've tried all the things that they've suggested, whatever the case may be. So yes, Phenelzine is something you should try, and it's something that you should not try first because it can have side effects. So we're going to talk about the side effects, and again, I want to emphasize I have managed these successfully, and I will tell you how in the next video. So first off, I'm just going to briefly mention the side effects that I've experienced, which are pretty much all the common side effects, and a little bit about how I'm dealing with them now. So the first thing, and the big reason that supposedly Phenelzine and other MAOIs are dangerous, is because of tyramine. So food has tyramine in it. Some foods have more tyramine than other foods. If you eat a bunch of tyramine, your blood pressure goes up. That's normal. However, if you take MAOIs, those enzymes that are being inhibited are supposed to help deal with tyramine, basically. And so if they're inhibited by the MAOI, then they can't. And so your blood pressure can go up more, and you can have a hypertensive crisis. That means you have to, theoretically, be really careful with your diet. However, the thing is that there's a lot of bad, outdated information about that. I recommend you read a lot of information from the Dr. Ken Gilman, and what he suggests is more or less that we didn't have a good understanding of how much tyramine was in foods back then, back a long time ago when people had these experiences, and more importantly, modern production processes have changed how much tyramine is in foods and significantly reduced it. So for example, the tyramine effect of this medication and MAOIs was originally called the cheese effect by some people, because if you ate cheese, you'd have a hypertensive crisis and you'd have to go to the hospital and you might die. You're not going to have that problem. Modern cheese, especially supermarket variety cheese, has pretty damn low tyramine in it. Let me put it like this. There's a list of things you're not supposed to eat while you're on this medication because they have too much tyramine. Depending on the source you get it from, there will be more or fewer things on that list. I can tell you, I've looked at all of the lists. I've eaten pretty much everything on every one of the lists except that I don't drink, so I haven't tried things like craft beer. But I've tried pretty much everything on the list, and I've had pretty much zero reaction to anything. One time I ate a calzone, which had a large quantity of aged Swiss in it. I felt a little weird for a few minutes afterwards, and maybe that was my blood pressure going up, and it was not to a dangerous level. Different people have different tolerance to tyramine, but the thing is, you can try it. You can eat these foods that supposedly you're not supposed to eat. And this is coming from Dr. Ken Giltman, not from my mouth. I'm just repeating what he said and that I implemented it and that I found it to be true. You can try these things in small amounts and see what happens. And if you feel fine, you're fine. That's all there is to it. And if you eat pretty much anything in a reasonable amount, you're not going to have a problem with this, in my experience. And I will also say it seems to be in the experiences of other people, because I've read a lot of anecdotes about the side effects while trying to figure things out for myself. And truthfully, this is a side effect that very few people talk about, even though supposedly it's the most dangerous one and really the big reason why psychiatrists don't want to prescribe it. It's not actually that big of a deal. Okay? I'll talk about it more in the other video. Other things. This medication reduces your blood pressure while you're taking it. It doesn't reduce it by a lot. I already had slightly high blood pressure, now it's pretty much normal. It can also cause orthostatic hypotension, which means it reduces your blood pressure more when you stand up. You will notice that, unless you have really bad balance issues, probably because you're an older person or something like that. It's not going to be a problem. At the dose I'm currently taking it at, I don't experience it. At the dose I started taking it at, which was a higher dose, I did experience it, and it was a mild irritation that when I stand up, I would lean on something for a second, roll my eyes, wait for my head to adjust, and I'd be fine. Not a big concern for most people. It can also reduce your blood pressure when you're exercising. So this was a more notable side effect for me. I could start to feel sleepy while I was running. And for me, running was the only thing that caused it. Anything but cardio, probably not going to cause it because it's blood pressure related. And for me, like stationary biking, didn't even notice it. It was just running. Maybe actual biking, maybe swimming. For me, the only thing that actually did it was running. And so I'd started to feel a little sleepy while I was running. And one time when I ran quite a long distance for myself, which was like 7.5 kilometers, my feet started to get numb. And I think probably I performed a little worse at exercising when I was on the higher dose. So that is a side effect to think about. However, I will tell you, as I will in the other video, I think you should end up taking a lower dose than what you might think at first, for both the anxiety effects and the side effects. And I have no problem with it now. My exercise performance is totally normal. It's great. So not a big concern. Another thing is B6 deficiency. This medication is going to most likely cause B6 deficiency in you. You're going to notice that because your fingers are going to get tingly, and occasionally you might have little muscle spasms where your hands jump and stuff. Take a B6 supplement. Dr. Gilman recommends you just start one as soon as you start the medication. I decided to wait and see. I had the side effects. I started the B6 supplement. They went away. Take a B6 supplement. Other medication or other side effects. You can have insomnia, so inability to sleep at night, as well as daytime drowsiness. I did experience both of these. The daytime drowsiness definitely got milder for me really quickly, and to the extent that it remained, it was mostly because of the insomnia. I wasn't sleeping very well, and I would take caffeine. I've never taken caffeine before. I would take 50 milligrams, and it would solve the problem. The insomnia was a bigger problem when I was taking it at a higher dose, but I figured out, as I said, a lower dose is actually often better, and the insomnia has totally gone away from me. And I also want to mention, I had insomnia before Phenelzine. Phenelzine made it worse. So I do in fact still have insomnia, but I don't have Phenelzine insomnia anymore. Basically, I take mirtazapine to help me sleep because of my insomnia, as well as melatonin. And while I was on the high dose of Phenelzine, that didn't help very much. So the insomnia was basically like, you don't enter REM sleep. So you don't have dreams, which is really cool if you're like me and you don't tend to have very good dreams. But also you don't get super solid sleep. And so you might wake up every hour and you can see that overall you're getting a good amount of sleep, but it doesn't pan out to being good sleep. And again, all of these side effects are going to vary. You may not have them. Some people just don't have them. Some people have them less severe. I got pretty severe insomnia, which didn't surprise me at all because I already have pretty severe insomnia. But yeah, lower dose, it's gone, it's not an issue anymore, and the anxiety reducing effect still remains. So yeah, and again, I'll talk about that more in the next video. Last side effect I want to mention, sexual dysfunction. Supposedly, this side effect occurs in about 50% of men and 1/3 of women. I think it's probably higher for both. I think it's probably especially underreported in women. And based on what I've read, most guys do experience it. And I think it's probably that most people will experience sexual dysfunction. And I did. And at first I thought I didn't. And I was telling somebody about the medication I was taking. I was like, yeah, I've experienced that from meds before, and supposedly this one's bad about it, but I haven't experienced it. It takes some time to kick in, and it depends on the dose. If you keep the dose at a lower dose, you're going to have a much better time with it. So now that I'm on the lower dose, it took about 2 weeks, and I'm fairly normally functioning at this point. So yeah, that's the side effects. That's a lot of side effects, but I've managed them. And the thing is, I want you to know about the side effects. I don't want to try to convince you that there are absolutely no downsides to taking this medication. I also want to convince you that if you have treatment-resistant social anxiety and nothing has worked, first off, there's a very good chance that this will work, in my opinion, and in the opinion of smarter people than me. And secondarily, it's worth dealing with the learning curve and figuring out how to manage it, because it's amazing. And if you feel like your life is actually impaired by your anxiety, which if you have avoidant personality disorder is pretty much necessarily the case, it is worth trying this medication if you've tried other things already that didn't work. And if nothing else, I want you to know that it's an option, because you probably don't. And that is the worst thing of all. It's much like AvPD in the first place, and why I started this channel. Most people don't even realize AvPD is a thing. And so people can have AvPD and have no idea, and it helps them so much to know about it. I just want you to know that Phenelzine exists as a treatment option for social anxiety. You've probably never been told about it, and you should consider taking it. Another thing that's really important about side effects that I didn't mention is that no side effects are known to persist after discontinuation of the medicine for more than 1 month at most. Whereas theoretically, things like SSRIs are known in a small percentage of people to cause permanent sexual dysfunction. No side effects of Maui's or Phenelzine are known to act like that in any people. And another thing I want to mention about side effects, which again I'll talk more about in the other video, but it's that these side effects can just go away by themselves over time, and they very frequently do if you stay at the same dose. And there are also medications you can take in conjunction to deal with them. So there are a lot of options, but in general, you may not need them. I didn't need to wait, and I didn't need to get additional medications. I just needed to find the dose that was right for me, and I'll be talking about how to do that in the next video. I just wanted you to know that this is an option, and people that do prescribe it consider it to be the best option for treating social anxiety in people where nothing else has worked. It is potentially the most effective, and it does potentially have the most downsides, and you can potentially manage them very well. I would also just say I recommend using it in conjunction with therapy, both individual and group if possible. And I would say that about any medication. I just think it's a good idea, especially for people with anxiety. For me, the most important thing that individual therapy does is to have someone to talk to who I really enjoy talking to and who makes me feel better. That's what it comes down to. It's not really about the therapy part. It's about the fact that I don't really have people to talk to at all about anything. And having a therapist is great when it's a good therapist. And group therapy, again, it's exposure. And exposure at the end of the day is what you're going to need if your goal is to do more things. And the thing is with this medication, I feel so much better just existing, just being able to go outside in the sun, just being able to run basic errands, and just having less stress, dread, and shame about things when I'm just sitting around my house. This medication is worth taking, period, even if you're like I don't really want to be less avoidant. I don't want to expose myself to new things. I don't want to be social for any reason. I don't really care about having new connections with people. These are things I do care about. You don't have to care about them for this medication to still be worth it, because I just feel so much better and I can work on my creative projects alone and feel so much better and less depressed. And this medication can help with depression as well, depending on what dose you take it at. And I would say I'm taking it at a dose where I'm not getting the profound antidepressant effect. And I'll explain more about that in the other video again. But I still feel way less depressed because my anxiety is so much better. And I have so much more energy. And so doing things alone is a lot more pleasant too. So yeah, if you have anxiety, I totally recommend trying it. So try other options first, but please do not give up and believe that there are no other options before you try Phenelzine. And I guess really the moral of the story is you need to advocate for yourself. You need to do research for yourself, and I hope to make that easier through the research that I've done for myself. And find a good doctor. And at the end of the day, your doctor should have something to try. And if they don't, you need to do more research and make sure that they're right, that there really is nothing left to try, whether you want to try Phenelzine or not. And if you do want to try Phenelzine, find a doctor who will prescribe it for you. Hopefully, if you already have a doctor, they will. My doctor does not often prescribe it, and she was quick to tell me about all the warnings and risks, but she did prescribe it when I specifically asked her to, even though she told me there was nothing left to try. And it's working. It's not a magic bullet, but I feel so much better. That is the pros and cons of Phenelzine and why you haven't heard of it. And the next video will be about how to take Phenelzine. Thanks for watching. I hope this helps.